These days, elderly usually more energetic than the backpacker grandkids. However, there are some tips to be considered for elderly during traveling. First, when to go. Most elderly retired and can travel whenever they want. When you plan to take a European travel, you can consider months with low crowds and avoid the heat of summer. You can travel during September or October, or during April and May. During April and May, the internet is an invaluable resource for booking flights, checking train schedules, researching and reserving hotels, and lots more. Ask someone to help you to find the affordable things you need for traveling. Find out exactly whether and how your medical insurance works overseas. Pre-existing conditions are a problem, especially if you are over 70, but there are plans that will waive those exclusions. When considering additional travel insurance, pay close attention to evacuation insurance, which covers the substantial expense of getting you to adequate medical care in case of an emergency, especially if you are too ill to fly commercially. Packing, hauling a big bag is a major concern for elderly. Consider of using a roll-aboard suitcase for your luggage. Bring a small bag that stacks or attaches on your wheeled bag. To lighten your load, take fewer clothing items and do laundry more often. Medications and health. Be certain to take a full supply of your medications. It can be difficult and time-consuming to fill a prescription in Europe, and even non-prescription medications, like vitamins or supplements, may not be available abroad in the same form you're used to. You may have to use the generic name if you need to buy your prescription abroad, since there is possibility of pharmacists do not recognize the brand name. Ask your doctor before you leave for a list of the precise generic names of your medications, and the names of equivalent medications in case of unavailability. If you wear hearing aids, be sure to bring spare batteries. It can be difficult to find a specific size in Europe. Know the nearest hospital in your destination and note the number. Flying, check your bag and luggage in transit airport, in case you are not flying direct. Ask the airline or flight attendant to arrange transportation so you can easily make your next flight. Since cramped leg can be a concern for elderly, book early to reserve aisle seats or even a roomier economic flight. Stay hydrated during long flights, and take short walks hourly to avoid the slight chance of getting a blood clot. Accommodations. You can request a ground floor room if you think you cannot take stairs too much. No matter where you stay, ask about your accommodation's accessibility quirks, whether there's an elevator, if it's at the top of a steep hill, and so on before you book. If you think you are not able to walk and take stairs, then you must avoid subway. Consider using city buses or taxis instead. If you're renting a car, be warned that some countries and some car rental companies have an upper age limits, so mention your age when you are booking a car. Also make sure that you know the driving lane, because there might be different driving lane in different countries. Invite a relatives to join. Ask a family member to join. The journey will be a benefit, especially younger relatives. They might give you huge assistance during the vacation. Younger relatives will help you adapt with the technology that possibly unfamiliar or even seeking information. Although the destination is not too far away, we recommend to keep attention on the tips above. Keep maintaining your health and personal safety so that the vacation moments remain comfortable and exciting. Don't push yourself too hard, because the purpose of traveling is to enjoy the moments. Do not forget to also capture happy moments during the journey. And happy holidays. Happy holidays.